Welcome back, beautiful tri-state area. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York iHeartRadio. I'm your host, Zen Sams. In our Going Deep segment brought to you by CO2 Lift, we're featuring Ryan Bourgeois, FNP-C, and that means an aesthetic nurse practitioner. He's founder of Bougie Aesthetics, and he prides himself on natural facial balancing. Impressively, he was voted top medical aesthetic practice in Fort Worth, Texas. He joins me today to chat latest non-surgical procedures, his most requested beauty treatment, and the latest trends and uses for carboxytherapy for skin rejuvenation. Carboxytherapy, or what they call carbon dioxide therapy, is a non invasive procedure involving the therapeutic use of carbon dioxide for skin regeneration. When infused into the skin, CO2 immediately diffuses at the cutaneous and muscular microcirculatory levels, resulting in higher tissue oxygenation and neoangiogenesis. Basically, the blood vessels widen, they increase the transport of oxygen body tissues for cellular regeneration and anti inflammatory effects. It's all in the science. It's a treatment that's been around since the 1930s, but the method of delivery has improved since then with a gel delivery system called CO2 Lift. But don't take my word for it. Welcoming now to the show is the amazing Ryan Bourgeois. Welcome to the show, superstar.
Thank you, Zen, so much. Appreciate it for this time.
All right, let's dive right in. So, it's a little known secret that you dabbled in TV as an actor in soap operas, and I heard that you were a medical consultant for Days of Our Lives and General Hospital, collaborating on scenes with directors and actors to bring believability. What made you transition into medicine, and what inspired you to become an aesthetic nurse practitioner?
So at first, I was a registered nurse, and I wanted to go out to Hollywood to chase that pipe dream of being an actor. My mother said that you need to have a contingency plan before you break upon that goal. So I said, okay, got my RN, moved directly out to LA, and hit the ground running. I was on General Hospital from 2002 to 2009. I've always been in medicine. I've got 18 years of emergency medicine as my background, 5 years of aesthetics. But yeah, that I used my nursing background to help me get into the industry.
It's a beautiful mesh of art and science, and you're living out your dream. You went where there is no path, my dear, and you left a great big trail. Very proud.
Thank
So,
you.
you were voted top medical aesthetic practice in Fort Worth. Can you share some key elements that contribute to your success and how you approach natural? I know you're all about facial balancing in your practice.
Yeah, I like my patients to look as natural as possible. I don't follow the trends of everybody putting a bunch of filler in the face. I don't feel like filler is the answer. I feel like biorejuvenation is the answer with types of treatments like Sculptra or Radiesse or even the Carboxy mask, PRP. I like stuff like that. So, truth be told, that's what's in. I have Sculptra in my face. I've got Radiesse in my face, and that's why I'm 46 years old and look as natural as possible. I don't have hardly any filler. I just feel like like I said, you're not treating facial aging. You know what I mean? With the bioregeneration, you're using collagen stimulation in order to combat facial aging because you lose at the age of 20, you start losing 1% per year. So if you're 40 years old, you've already lost 20% of your collagen. Not to mention, the bony changes that you're going to have and how, you have maxillary recession, you have mandibular recession, ramus recession. And there's ways that I go about treating that to try to protect the bone per se as you get older.
Well, you look fantastic, so
Well,
I'll
thank
take
you.
your word for it. So, what are some of the latest and most innovative non surgical procedures in the field of aesthetics? And how have these procedures evolved over the years? I'm curious to know the benefits they offer compared to surgical options.
So I work hand in hand with local plastic surgeons. I have dinner with a plastic surgeon this evening. And the reason I do that is because the treatments that I provide, I want to make sure that down the road, when they do decide to have that facelift, that I don't hinder his job. So the way that I take my approach is For one, I like to inject the Sculptra down on the bone, a periosteal level, in order to create that collagen fibrin matrix in order to protect the bone. And it's to be told that, Sculptra is more of a fibroplasia, so it's more fibrotic tissue. And to me, you want something that's fibrotic, it's sticky, it's adherent, it's going to keep the face nice and lifted. At the surface level, I like to use Radiesse. Radiesse is also a collagen stimulator, but it's a different type of collagen stimulator. And the fact that it's not only type 1 collagen, it's type 3 collagen. There's also elastin, which gives your skin the stretch. There's proteoglycans involved, which actually pull water, provide hydration to the face. And that's how Radiesse gives you that beautiful skin glow that you get. So those are the kind of approaches that I like to take. I like mixing it with PRP. That's your blood, it's your growth factors. I actually have a treatment too that I do called Easy Gel. I take your blood, I spin it, I activate it, and then I heat it up and I turn your blood into a filler. And then I inject your blood back into your face. And over time, you're going to release those growth factors. And when you put those types of things together, the plasma, the Sculptra, the Radiesse, the bioregenerative treatments, that is treating facial aging.
Combo therapies are so important, and I think carboxytherapy, if we're going to circle back to this, it's interesting to me because it was one of the number top 3 Google searches for Q4 of 2023. So carboxy therapy, as you know better than anyone, uses carbon dioxide to stimulate blood and lymph circulation to the area being treated and improve, of course, circulation and elasticity and fine lines and wrinkles. But the old way to administer carboxy therapy was by subdermal injection of CO2 with a thin high gauge needle, right? But this application caused some pain and tons of discomfort and left minor bruising. So, what is the new improved method, and what is CO2 lift carboxytherapy gel?
So yeah, the CO2 lift, it's a topical form of providing the carbon dioxide that's going to lead to the vasodilation and the rush of oxygen, nutrients, blood to the surface to help with the healing. It's amazing. How I first got into it was, I'm very skeptical with anything. I had a patient that came to me for actually some facial work, and she had a psoriatic lesion on her leg. And she said, "Do you know what this is?" I said, "It looks like psoriasis or the eczema. I've came across this mask that we're doing on the face, and I'm seeing good results. And it's used for actually the issue that you have. I would love to, as an experiment, put it on you and see what happens." And within one treatment, she had a 90% improvement. And that was, I couldn't believe it. I was blown away. I was like, okay. And then I started diving into this, going, what really is this? And how does it work so well? And, we offer free bruise treatments here at Bougie. And so we use a Lutronic Ultra. I use a laser that to kind of stimulate the bruise and to help heal it a lot faster. On one of the cases, we did that, and then we put the CO2 mask on top of it, and the actual bruise came out of the skin and onto the mask.
Wow.
Pictures of that too. It was, and then so the mask, the part where she had the bruise on her chin, the mask was purple. So you're using the laser to break up the bruise, to blast it, open it up, and then you're using that CO2 mask, to rush that oxygen-rich blood to the area, which in turn led it to come out of the skin. It was crazy. But yeah,
That's fantastic. I mean, it's all science, because what you just said is the exact science behind carbon dioxide therapy. It increases the presence of wound repair factors and growth factors, to your point, which then help cells turn over faster, reducing the appearance of aging and scars and stretch marks and so much more. In this case, reducing the appearance of the bruise, but stimulating collagen, back to your point that you made at the beginning, and elastin production promotes elasticity and helps retain hydration. And to my understanding, this product does that. But then it also improves local metabolism and elimination of waste products, which then helps the body to heal localized damage, such as scars or acne and hyperpigmentation. Now, I particularly have a true story. I just recently, December 18th, explanted implanted my breast implants with Dr. Rankin in Jupiter, Florida, and opted for a natural lift. I then called the founder and I asked her about CO2 lift, and she said Dr. Hoyos compared this to a hyperbaric oxygen chamber. He uses it after open flap surgery. So I put it on my scars of 3 days post surgery I had an anchor lift done. Can I tell you that I'm 3 weeks out and I have minimal to no scarring compared to women who are 9 months out of surgery? So it's fantastic, regenerating and repairing damaged tissue to help clients achieve better looking skin, and even damaged skin is incredible. So I'm glad that you endorse it. Now, can you share with us your most requested beauty treatment at Bougie and what makes this particular treatment so popular among your clients?
It's the bioregenerative treatments for sure. It's the Sculptra and the Radiesse that people come in, requesting. A lot of people come in and they see the befores and afters. I've got well over 800 on Instagram, and they trust me. So they come in and I'll ask them what they're looking for, like what bothers you. When you look in the mirror, do you feel like you're sad? Do you feel like you're mad? Do you feel like you're, and a lot of them people do. I don't see the person I see in the mirror. I feel a lot younger than what I look. So when they come and see me, I use those bioregenerative treatments, and it's usually not a one and done. It's like I said, the way that I do it: Sculptra down on the bone, for that architectural support, Radiesse to the surface to help, rejuvenate that skin. But that's definitely the most requested. But we're the practitioner, right? Our job is to assess, diagnose, and to treat. So it's not like you come in here and there's a menu and go, well, I want lips and I want cheeks and I want chins or whatever it may be. It's about treating facial aging. It's as you age and you get certain ages, there's when you hit about mid-30s, you're going to start seeing, this is going to start going down. You're going to lose some of your deep fat. You're going to lose collagen elasticity. You're going to start having some tear trough changes. And that's very typical. I see that every generation that comes in, it's almost identical to the complaints that they have.
Yep.
Well, with the 40s, it's different. In the 50s, it's different. And, but yeah.
Well, it seems like you have a nice grip on how to give a proper consultation and what to look out for and how to assess, and then, of course, steer them in the right direction. We have about a minute left, and I want to talk to you about advice for aspiring professionals because I know you're very big on training. So, for those aspiring to enter the field of aesthetic medicine, what advice would you give them, and how important is continuous learning and professional development in your field?
So, I spend about 40 to 50,000 a year in education, and I go to the best of the best. And the reason I do that, when you look at a face, from an artistic standpoint, I can tell what it needs. But the problem is I didn't know how to get the outcome that I wanted. So I would say, who's the best? And I don't care what they cost. And I will go train with them. But the key is not to only train with them once. The key is to train with them and then go back and train with them again. Because once you implement their treatment and you do over 100 cases and you see befores and afters, go back to that doctor or that nurse practitioner that you learned from and ask them, about your outcomes. You know what I mean? Does that make sense?
It makes a lot of sense. And this is why you are as popular as you are, because you're very thorough. You cross all your T's and dot all your I's. You do your research and your homework, and you resort to long-term, beneficial, sustainable solutions versus fillers, and putting a band-aid over a band-aid over a band-aid. And then, you end up with all kinds of migration in the face from fillers that have,
Right.
been stacked or gone wrong. We are out of time. I want to thank you so much for coming on. You're full of knowledge, very entertaining to talk to. I'm glad you didn't choose the entire acting career path because we definitely need you on the aesthetic side.
Well, thank you so much. I appreciate you. Thank you for your time, Zen.
That was our Going Deep segment brought to you by CO2 Lift. That was the incredible Ryan Bourgeois, FNP-C, an aesthetic nurse practitioner and founder of Bougie Aesthetics in Fort Worth, Texas. You can check him out on the gram at Ryan_Bourgeois_FNP, or you can check them out at _Bougie Aesthetics. You can also head directly to their website at bougieaesthetics.net. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York iHeartRadio. We'll be right back after this.
A Moment of Zen is brought to you by CO2 Lift. As we age, our skin loses moisture and elasticity, causing wrinkled skin. You can reverse this aging process with CO2 Lift. CO2 Lift utilizes the powerful benefits of carbon dioxide to lift, tighten, and regenerate your skin. This simple, painless at-home carboxytherapy treatment is scientifically proven to reverse the aging process. You will see reduction in wrinkles, increase in luminosity, and improve pigmentation, sagging, skin tone, and radiance. For more information or to order CO2 Lift, go to CO2lift.com.